Hey squad, welcome back to the channel. On today's video, we look into the pathophysiology of atherosclerosis, or what is commonly referred to as the hardening or stiffening of the arteries. Atherosclerosis is a chronic condition in which there is a hardened plaque buildup in the arteries of the body. This plaque can lead to the narrowing of these blood vessels, which in time could cause secondary conditions like angina, myocardial infarction, kidney failure, or even strokes. Now let's jump onto the computer and draw out exactly what occurs within the blood vessels to create atherosclerosis. Alright guys, now that we're looking at the drawing here, we're going to really break down atherosclerosis, the hardening, stiffening of the arteries in a super basic cellular construct, thought process here, because understanding what happens within the vasculature walls will help you guys better understand what occurs, the pathophys here, and ultimately why there are secondary issues after atherosclerosis actually forms over a chronic long period of time. So there's a couple things that has to happen. Remember, I'm going to lay out a lot of the risk factors right after we're done with this drawing, but quickly, there are three big irritant risk factors in the buildup of atherosclerosis, and that is going to be hypertension. Okay, so your chronically high blood pressure patients are going to be at a bigger risk for developing atherosclerosis. Okay, I want you to just to imagine, there's no real way for me to draw it, that there is a high pressure system going through this artery here. So this patient has chronic hypertension. Okay, the next thing are going to be toxins. Okay, there's going to be toxins floating around the bloodstream. Okay, so we're going to have little toxins here. Okay, they're floating around. Okay, and we're going to label these as toxins. Okay, and these toxins are specifically from cigarette smoke, the nasty things that you inhale that gets into the bloodstream from your cigarette and tobacco use. Okay, then the last one that's an irritant is cholesterol. It's specifically bad cholesterol. Okay, your LDL cholesterol, okay, is your bad cholesterol, and that is what is going to create the hardening effect, and you guys will see this. So let's put some LDL cholesterol in here. So this is LDL, okay, and that's just free floating in the bloodstream. Okay, these are your irritants. Okay, so the first thing are irritants. Okay, those are the things that are going to create the issues for where the plaque is now going to sit. All right, so in your cell, in your vascular structure, you have the three walls of the vasculature itself. And remember, the middle one is going to come into play here. That's your smooth muscle layer. Okay, and then you have a single, on the very inside of the vasculature, you have one single layer of cells, and that's an endothelial cell. Okay, they're single layer, and that is where these toxins are going to start attacking. Okay, they're going to attack the endothelial cells. Okay, so what's ultimately going to happen is you're going to start to see damage on these endothelial cells. Okay, and there's going to be breaks in them, and these breaks create an opportunity to where the LDL cholesterol then goes and starts to collect. Okay, and they go, ooh, this is a really, really nice cushy spot, right? And they start to collect here. Okay, and ultimately when they collect, they start to create what's called a fatty streak. Okay? And this is the start to atherosclerosis. When you start to get the deterioration of the endothelial cells and from the toxins, from the LDL, and from the chronic hypertension, you're now going to get these fatty streaks, these deposits. Okay? They're not any deeper or wider, I should say. They're not any wider than the endothelial cells, which is why they don't cause much of a problem. They're just there. So what now starts to happen is these fatty streaks trigger a different type of cell to come in. Okay? They trigger a monocyte cell to come in. Okay? We're going to say these big gray things here are the monocytes. Okay? Monocyte. Okay? A monocyte is a white blood cell. And they're going to come in and they're going to start eating these LDLs. Okay? They're going to say, we don't want you there. We want you, out of here. We're going to start eating you. And they're eventually going, so we'll draw it down here. The monocyte, okay, once they start eating, is going to eat the LDL, okay, in the fatty layer, and they're going to transform into a different type of white blood cell called a macrophage, okay? And these macrophages eventually are going to get so full of these LDLs that they're going to die, okay? And when they die, they're going to die within these fatty streaks, okay? So let's put one right there. They're going to die within these fatty streaks. And so they're going to die. They're going to have cellular death. And they're going to then turn into what's called a foam cell. Okay? Stay with me. I know it's a lot of cellular microbiology here, but they're going to turn into what's called a foam cell. And the foam cell is going to sit there, and it's going to collect. And more LDL is going to come over here and collect, right? It's going to keep collecting around all of these foam cells, right? So it's just going to keep collecting and keep collecting and keep collecting. And now you see that it went from a streak to now an actual bulge from the endothelial cell wall. Okay, so the LDL continues to keep going, and then you got more macrophages and everything coming in here. So they're going to come in, and they're going to keep collecting, and they're going to die. And this whole thing just keeps getting bigger and bigger and bigger. Okay, now you can kind of see we have a narrowing. Okay, this is where we start to see the first big thing with atherosclerosis is the narrowing of the arteries. Okay? So this is significant symptom number 1. So we'll put down here symptoms. Okay? The first one we see is the narrowing of the arteries. Because this starts getting so big, these fatty streaks turn into plaque-like structures. And how they create plaque-like structures, and we're going to turn back into orange here. So let me turn back into orange here, is the smooth muscle starts realizing that these macrophages are turning into foam cells. And they start coming from the smooth muscle into the buildup of LDL and foam cells, and they start depositing calcium. Okay, they start depositing this calcium within this plaque layer. Okay, and calcium. So we'll say here the smooth muscle deposits calcium. Okay? And calcium, we know, is a hard substance, right? Our bones are made of calcium. So when we're thinking calcium here, we have to think that this is going to now get hard. This is where plaque becomes rigid and hard, a hardened structure, because the smooth muscle deposits this calcium within this this LDL and foam cell buildup. But what it also does is it releases different fibrous cells, and the fibrin begins to create a cap. Okay, so it also releases fibrins. Okay, and this fibrin creates a fibrin cap over this plaque-like structure. So now you have a rigid structure. This is completely ribbon. Fibrin is rigid, calcium is rigid. The LDL and the foam cells are stuck in there behind these calcium and fibrin caps, and now this is a rigid structure. So now look at the diameter. We had, a very open, wide diameter blood vessel, artery, but now we're going to a very narrow diameter for blood flow to actually start to come through this. Okay, so the narrowing of the arteries, that's going to happen, but because of this fatty cap or this fibrin cap, and because of the calcium, you're then going to get your second symptom, which is the hardening, okay, of the artery wall. Okay, this becomes stiff. Okay, and this is where that stiffening happens. So now what we're most concerned with is twofold. Okay, so we'll put concerns up here. Concerns. Okay, there's two big concerns. First is a blood clot. Okay, as blood comes through here, at times something could pop off of this fibrin cap. Okay, so let's say we lose this piece here. Okay, and it starts floating. It starts floating downstream. Okay, see you later, goodbye. Well, what's ultimately going to happen is your blood vessels are going to start to say, hey, we need to, I'll make your blood nice and dark purple. Okay, we will start to see that the blood vessels start to do their clotting process, right? And they're going to start clotting here. Okay, we'll make these a little bigger. So they're going to start clotting. Okay, and platelet cells are going to come here and they're going to form a clot, a hardened clot, which then narrows this even further. Eventually, if this clot gets big enough, it might completely block off this artery, now causing decreased or cease of blood flow. And depending on where this is, we now have an issue. We could cause MIs, we could cause severe angina, we could cause loss of perfusion of cells, we could cause kidney failure, depending on where this atherosclerosis is actually occurring. The last thing is we have to take in consideration this thrombin, this clot or this piece of fibrous tissue that broke off. Okay, so we're going to call those thrombins. Okay, and these thrombins are, again, just plaque that have broken off that are going to go downstream and get stuck somewhere. So if they get stuck in a coronary artery, they're going to cause an MI. If they get stuck in a carotid artery or a brain artery, they're going to cause a stroke. If they get caught in a kidney artery, they're going to, cause kidney failure. These are just as bad as these blockages that could form from the actual tearing off of that fibrin. So guys, I hope this makes sense. Let's jump back into the regular video, and we're going to talk all about risk factors and assessments. Atherosclerosis can form anywhere in the body. Depending on where the plaque forms, it could cause significant problems, like coronary artery disease, carotid artery disease, peripheral artery disease, aneurysms, and chronic kidney failure. This is why a thorough patient history must be taken. Finally, let's review the risk factors associated with developing atherosclerosis. These risk factors include chronic hypertension, hyperlipidemia or high cholesterol, diabetes, obesity, smoking, an unhealthy lifestyle and diet, lack of exercise, and finally a family history of heart disease. However, with diet and lifestyle changes, most of these risk factors can be avoided and atherosclerosis prevented. Well, that's it for today, guys. As always, stay safe out there, and I will see you in the next video.